All right, it's Stephanie with the patient story again with Shari, who's in the middle of sharing her mantle cell lymphoma journey. Shari, thank you. You just outlined the journey of trying to figure out what you were dealing with and then finding the right oncologist, hematologist, oncologist. What we'd love to talk about now, of course, is the treatment part. And I know you did start off with the R-CHOP. So can you talk more about that chemo cycle, this chemo regimen, side effects, and, just kind of take us through what that all felt like?
It was not as bad as I had expected, actually. I'd heard all these horror stories about, the people throwing up and, losing like tons of weight, which was actually something like, yay, a weight loss program, at least, but not, it actually didn't affect me quite like that. Of course, it's scary as shit. I mean, I was really nervous going in for the first time. Well, before that, of course, they put a subcutaneous port in. I had to have that done. That alone freaked me out because more needles. Oh my gosh!
Did you actually talk about getting the port? And did you decide? Because sometimes people get the option of port, pick line. Were they like, you have to get a port because of this chemo regimen, and then describe the actual surgery?
Yes, when I went, Dr. Greenberg said, you need to get a subcutaneous port. It'll be a double lumen port. And it really, in retrospect, it wasn't a big deal. It's just the anticipation. You get a lot of anxiety because you don't know what to expect. And basically, they put you under. Propofol is my friend. And they make an incision. I think it's like right around here. They make an incision. They put this thing in there and they attach it to, a central vein, I guess. And then, and then they sew the skin back over it. So now it's covered, which is protective from from germs, because that's the biggest part about that is if you get infection in your port, especially if you, if you're immune compromised, then you die. And a friend of mine's brother-in-law actually died because of that. Lymphoma was gone. He got an infection in his port and he didn't survive, which is horrifying. So that I felt was protective. And then it really didn't take very long for that to heal up. That was like nothing. When it came right down to it. But the anxiety was worse than what actually happened. So then when you go in to get your chemo, they go into this little room in hazmat gear and they mix this stuff up in front of you. And they usually put in an antiemetic to keep, so you don't get sick. And they put in, they also give you stuff for allergies so that in case you have an allergic reaction, which actually ends up making you fall asleep. So I usually slept through quite a bit of my treatment. You go in, I put that LMX cream on there and covered it with some saran wrap for an hour before I was getting they were going in and puncture me. So that when they did puncture me, I felt like nothing. It just felt like somebody touching my skin. Problem solved. So that was good. And they sit you down in this very comfortable chair. And you lay back, you have a book, and you start to read, and then you fall asleep, and 8 hours later, it's done. I guess my treatments themselves were about 6 hours.
Okay.
I was going every third Monday for that.
Right.
And after that first Monday, and I think the 3 weeks that within that next 3 weeks, I did feel a little nauseated, nothing real bad. I went to work the next day on Tuesday, and the rest of the week I went to work. I was fine. I got up, and by the end of the week, I was really tired. And I was a little on the queasy side. And somebody, I forget who it was, told me, get some fresh ginger root, peel it, take about an inch long piece and steep it in hot water with a little bit of honey. And it helped the queasiness. But that was only that for that first time. The next week, or the next treatment, which was 3 weeks later, Dr. Greenberg came in and said, listen, there's a phase 3 trial of adding Velcade to Rituxan, that monoclonal antibody. And Velcade is something that's used, it's been very effective for multiple myeloma. And there are some similarities between multiple myeloma and mantle cell lymphoma. They said, well, let's see if this helps. So on the intervening 2 Mondays, then I just went in for 4 hours. I got an infusion of Rituxan and Velcade, and they had an infusion for the Rituxan, and then they just basically injected the Velcade into the line. And so that was it. And that was usually just a 4-hour thing. So I would go in the morning, and then after that, I went home, I had some lunch, and then I went to work. So that was from that point on, that was my regimen. It was Monday, I'd have the R-CHOP. Then the next 2 Mondays, I'd have Rituxan with Velcade, and then the R-CHOP again. And I did that.
For 6 cycles, right?
Yeah. And like I said, I went to work every day, except for the all-day chemo thing, because that R-CHOP, I was there probably close to 8 hours by the time I was done.
Took too much time, yeah.
Yeah, that was, I was done for the day. So, and then I usually would go home and take a nap, because that Benadryl or whatever it is they give you, it just made me sleepy. And then, I really didn't have any other effects. On the weekends, I went biking with my bike club, and
wow, that's incredible. I have to say, I've done so many of these interviews with the lymphoma treatments, including with R-CHOP or other regimens. You are, I think, the first person I've talked to who has worked through the treatment. Yeah.
I didn't know any different, so I just did what I felt like I could do.
Yeah, that's what's wonderful. We all have very individual reactions and responses to these drugs, by the way. So, for you, it sounds like you did get fatigued by the end of the first week, which is usually the worst week, is that first week. Sometimes the second it seeps into. You had some nausea, not quite that strong. It was a little queasy in parts, but only in that first cycle, and you used ginger root tea. So it really sounds like your body, just sort of took it well in that sense, in the side effect sense.
Well, I think what helped is the fact that I was extremely healthy and fit before this happened. I rode 160 miles before. So I think the fact that I was relatively young, 50 might not seem young to you, but it to me, 50 was young and healthy. And I think that really, really helped. And I want just a little aside. At the time that I had my cancer diagnosis, there were 4 other people in my bike club, all diagnosed with different types of cancer. One had breast cancer, one had thyroid cancer, another one had colon cancer. Every one of them survived. Every one of them survived. They all got through it. Everybody was generally young and healthy, and I think that really helps. If you can stay healthy before you get it.
Right. No, it definitely helped. By the way, I don't think I've ridden 160 miles of anything in my life, period.
I don't really have to drive that far, but it's fun on a bike.
Right. No, I love it. It of course, the age, the health, and all these kinds of things are different factors that can contribute. So, on the note of side effects, one is hair loss. And it's one that people, worry about or have anxieties about. I know you ended up losing it twice because later you had to get that conditioning chemo done. But this first time that you got this sort of hair loss, you were expecting it, I imagine.
Oh,
right?
yeah.
And how did it feel, and what did you do about it? And any sort of tips for other people?
Well, it really was the least of my worries. I really could have kept. I had great hair. I will tell you that. I had beautiful, thick brown hair. By the way, I still don't dye my hair. It never really changed. But anyway, I had real thick, great hair. I love my hair. And when I would, started waking up every morning, and there'd be like this Angora cat laying on my pillow, I'm like, oh, darn it. So, I said, there's enough of this. I can't stand this mess. And there was a place not far from where I lived that had a wig shop that catered to women who were, people who are going through chemo, and they're a very private booth. They shave your head and you can pick out a wig. So I picked out 2 wigs, one like an everyday wig and another Sunday go to meeting wig it was fun. The truth is, it really didn't bother me. I didn't really wear it except for when I was yeah, at work. I didn't, or when I was going out. Usually around the house, I just was bald and I didn't really care. The best side effect of this whole thing, I didn't have to shave my legs for 2 years. It was awesome. So saved a lot on shampoo and razors. So, but it
That's
really didn't bother me all that much. I
great.
hear about that a lot.
Yeah.
The last thing I wanted anybody to do was shave their heads in solidarity. Why would you do that? If that makes somebody feel good, great for them. I think it's awesome. But I just didn't want anybody to do that because I didn't feel that bad about it.
I love hearing how you were able to sort of, you just are let's keep going, let's do this. This is just how it's going to be. And so this is, I imagine, you're working through this whole thing, the hair loss doesn't bother you all that much. Then you get to I know you had a midway PET scan, and then there's like a post-treatment PET scan. Did
Right.
you have what people call scanxiety at all about these scans?
No, not at all.
What was
Not
going
at
through
all.
your mind, I guess, while you were going for these scans? Was it like, it is what it is?
Yeah, it's like, well, I just want to find out. I
Mhm.
like information. So, knowledge is power. So let's see what happens. And the PET scans were great that, once the halfway through, there was no new growth. The PET scan's really interesting in that you fast, then they give you an injection of basically kind of like sugar water. And wherever there's a lot of growth, meaning there's the cancers there, it's gonna like shine like a beacon because that growth is going to be around that sugar. And I think something like that. That's the way they described it to me. And there was nothing remarkable. So the only growth that they actually saw was where the biopsy was done, and there was healing going on there. So there's new growth, but that's from the healing. So
Wow.
that was very nice. I just wanted to know. And
Right.
then once I knew, and I could,
Move forward. You
I
have
could
to make
move
the
forward regardless of what
plan.
the answer was.
And so then, of course, you had great PET scans in that it showed no growth, no new growth in the midway, and then post PET scan was good. Plus the bone marrow biopsy, it says here, December 27th, you found that it showed that you were in complete remission.
Complete remission. There was no sign of it.
That's
So we're like, phew.
yeah. And I will add with mantle cell lymphoma, they do talk about great response rates to these sorts of initial treatments. And I think for people, they kind of worry about after. And so that's what that bone marrow stem cell transplant is for, is to really
Right.
help. Um,
Yes,
and
because
so,
they told me that it has a 90% relapse rate
Mhm.
with just chemotherapy, but it's like a 5% relapse rate with a bone marrow transplant from a strong donor.
Right. And so you can either have, you as your own donor, or you can have the allogeneic, which is what you got. Did they
No,
describe?
the allogeneic is let's see. Oh no, autologous is
Yes,
yourself. Right,
right,
right.
right, right. So you were able to get it from eventually your brother, which is amazing.
Yes.
Did they say why they recommended that path, and you couldn't get your own stem cells, or?
You can do autologous. As a matter of fact, right after my diagnosis, a guy that I worked with, his his girlfriend's sister was diagnosed with mantle cell lymphoma at age 50, and she didn't have a matching donor, so she did get the autologous. They radiated her whole body, killed everything off, and then she had that, and she was doing fine more than 5 years later. So it can be done, but the first choice is an allogeneic
And
with
then
sibling donor.
with a sibling donor, right? Actually, could you talk about that? What they described to you in terms of the right match, and then not. We won't go too deep into it. We can do another video on the actual
I'm not a
process.
doctor. I really couldn't get too
Right,
deep into
right.
it. I know the basics.
Right. With the basics of, in terms of the actual process that you and your brother ended up going through.
Well, first thing they went and had these HLA blood tests, and it's a human leukocyte antigen or something. Now, it's actually better to go with the brother even if Judy my sister matched, every child that you have, she had 3 kids, changes the HLA slightly. So even if we were kind of close, her 3 children would have moved us farther apart. So it would have been a more difficult transition. She didn't match anyway. My brother did. And so I was, stars shone upon me there again. And yeah, so he was perfectly willing. And I have heard of people whose family member did not want to do it, which is, I boggles my mind. I can't imagine that. But my brother, my sister-in-law said he would crawl across broken glass on his bare chest for me.
Oh,
That's it's like, well,
that's very sweet.
Beat the crap out of me when we were kids, so it's about time you did something for me.
It all comes back around.
It comes around, goes around.
Actually, Shari, I forgot to ask. I mean, you got the news of remission in December of 2004. Now, you knew you had to undergo the transplant, but when you found out that you were in remission, did you feel relief, or did you want to celebrate, or was it like, I want to wait till this whole thing's done?
No, I celebrated, but I knew we'd already started making the plans for going to Moffitt Cancer Center. About halfway through, Dr. Greenberg and I talked about it. He wanted me to go to the Fred Hutchinson Center, which is out in Seattle, and it was supposed to be the mecca for bone marrow transplantation. So I said, well, I actually contacted Moffitt Cancer Center, and they put me in with this Dr. Anicetti. And Dr. Greenberg says, Claudio Anicetti? I said, yeah. He goes, oh, I studied under him at Fred Hutchinson. I didn't know he'd moved to Moffitt. Oh, go with him. So that made me feel really good. If Dr. Greenberg said, Claudio Anicetti, yay, rock star, which he is, he's retired now. But anyway, he was another guy that absolutely adored that man. I mean, he was just wonderful. And anyway, so we had already had that plan started. And as soon as I had that bone marrow biopsy that showed I was in remission, all the results were sent to Dr. Anicetti. The ball started rolling for that. I had to have like 14 vials of blood. They had to make sure they checked for every single thing that you could possibly have in your body. Any virus, parasite, bacteria, anything. You had to be completely free of any of that. Right. So I had to go through that. My brother had to go through some of that. He had to make sure he was completely free of any disease as well before the donation.
Right. It has to be, it's a very clean process, obviously, to make sure it's pure and pristine. And so I know that required a 3-day conditioning chemo cycle, which I know you wrote as the worst
3 days of poison
day ever. Yeah. Can you describe that? And I'm going to pull up a picture from Moffitt Cancer Center while you're talking. So.
Oh, okay. Oh, you mean that what the conditioning chemo was like?
Yes.
Okay. So remember, this was the middle of February, beginning of February. The Sunday before I went there, I actually rode a 40-mile bike ride with my club at 20 miles an hour. So then Monday went in, they did all these blood tests, all these tests, got me in a room in the hospital in the transplant wing. And then they started infusing me. Oh, they put in a Hickman port. That's what they had to do on Monday. They put in what's called a Hickman port, which is I called it my teat. It sticks out of your skin, which is great because you don't ever have to be poked anymore. They just put everything in through the lumens. There was a 3-lumen Hickman port. And they had to start infusing me with this poison. And it's to bring your immune system down to nearly zero. It's called a non-myeloablative. So by that night, I thought, okay, get the number of that truck that hit me. It was really, I just remember being like halfway there. The next day they had somebody come in, and I had to have these infusions, like, I forget, it was like 12 hours of they had to give me a lot of water because it was, they called it actually bladder Teflon. It's some kind of chemical that kept this really caustic chemo from destroying the bladder. So it was pretty nasty. Anyway, they had an occupational therapist come in to help me literally from sitting in a chair, straighten one leg, put it down, straighten the other leg, put it down. Take my arm and go like this and put it down. The other arm, go like this, put it down. That was effort. And I'm like, I even said to the occupational therapist, do you believe it? Like 3 days ago, I did a 40-mile bike ride. So that was, and if you, my picture that you're showing from the Moffitt, you see how round my face was? There's a lot of prednisone in there. And so I had moon face.
It doesn't look like moon face to me, but yes, prednisone does do that, of course. And
Well,
when
actually, I went from about 100. I was about 170 pounds when I got there. I was overweight. I was I was fat. So, and like I said, the chemo didn't help me lose weight. I never lost my appetite. But with all the stuff, all the water and all the stuff that they infused in me, my head actually looked like a basketball. My brother almost fell over when he saw me. I went up to about 184 pounds
wow.
for about a week. It was very uncomfortable.
Yeah, they're
And
definitely
finally all the fluids started draining out of me and I got back down a little bit, but
weight fluctuations. I'm glad you're bringing that up, and the steroids have a lot to do with it. And you were
yes.
talking about, you meant physical therapist who's working?
Oh, the occupational therapist.
Oh, okay,
yeah.
Okay, all right, very good. And so after, how long after this chemo did you get to actually have the transplant done? Your brother?
Okay.
Yeah.
Yeah, so my brother had to go through 3 days of getting these Neupogen shots, which was very interesting. I was supposed to get Neupogen also. It's a colony stimulating factor. It's supposed to raise your white count. When you get the chop with Rituxan, it can deplete your white count. Turned out I was allergic to it. I went into anaphylaxis. So Jeff had to rush me to the hospital after the second time I got a shot of that. So they had to give me Leucine for that. Now my brother was not allergic to it, so he got these Neupogen shots. And what it does is it increases the number of stem cells, bone marrow stem cells in the bloodstream. So he was in a lot of, achy pain and everything. He never, not one word of complaint to me ever, like, oh man, I'm so sorry. Never said a word. After they gave him enough of this to really increase these bone marrow stem cells in his blood. Then he went through an apheresis blood donation. So they basically put a needle in each arm, and over the course of 7 hours, they took the blood out. They centrifuged out what they needed in terms of these stem cell cells, and put the rest of it back in. So it just kept going through his system, and they would just siphon off these bone marrow stem cells. When they had enough, I don't know how they measure it. When they had enough, they put it in a bag, and that's what they would use. That used that to transfuse me. So me being the silly person that I am, my mom was there, my brother, my sister-in-law, and my aunt was there to support my mom. And they're all in the hospital, in my hospital room as the nurse comes in to infuse. And basically it looks like a blood transfusion. It's a blood bag like this, and they hang it on a little hook, and they hooked it to my port. They went underneath my shirt and into my port. So I'm sitting there and we're watching this red stuff going down the line like this, and then it gets underneath the shirt, and I just started going, just because my brother cracked up. He knew I was joking. My mother and the nurse were going, and then of course I couldn't keep a straight face, and I started laughing because that's me. My mother says, I'm gonna kill you myself.
Yeah, she's like, when you survive this, I'm gonna kill you.
Exactly.
You were able to obviously keep a sense of humor through everything. It's such a nice breath of fresh air, and I love hearing about it.
That's my mom and me. She had the sense of humor.
That's probably where you get it from, I imagine.
So.
So I hear sometimes it described as sort of anticlimactic, the actual
Yes.
transplant, because you're just there. It takes like Was it 30 minutes or 45 minutes?
Yeah, yeah. I don't think it took 30 minutes. It just
Okay.
seemed like, I don't, well, maybe, no, it did take 30 minutes. It's pretty big.
Yeah.
I just, good. Everybody was chatting and we're talking, and so, I mean, I felt like nothing.
Right. Right.
I've had no sensation whatsoever from this infusion
It's
at the
it's a
time.
it's a few days later, right, that it starts to hit. So can you actually just summarize that for us? And how long did they keep you in the hospital until they let you kind of go home?
I didn't go home. We opted to stay at the Hope Lodge, which is right on the grounds of the Moffitt Cancer Center. It's a free facility that is maintained by the American Cancer Society, which I've donated a lot of money to because it was wonderful. And I would love everybody to have that opportunity. Some people did go to local apartments that were set aside for that. I felt more comfortable in this more pristine environment. It's a separate floor with very specific air filtration systems, and they have a special kitchen facility. So I wanted to be there, and plus it was very close to the hospital there in case I needed to go, and where all my tests and stuff were daily. Um, so I think it was they kept me there for a week, 10 days. It's shorter now. They've since over the course of these years they've modified. They know what works and what doesn't work. Or so anyway, I think I was there for 10 days before they moved me into the Hope Lodge, and I don't know, that was it's kind of filmy because was things are starting to happen. Like you said, about 3 days later, I wasn't feeling well. It's just like run down, odd. I was a little bit worried about hurting myself. They gave me a little foam toothbrush to brush my teeth with because you wanted to keep your mouth clean, but you couldn't damage any tissue. So it was like little foam toothbrush. It was very strange. But I tried to be human every day, take a shower, wash my hair, but it was tiring. I needed a chair in the shower to sit down. It was a pretty debilitating 10 days. I just remember that. I felt better once I got to the Hope Lodge, but I had a lot of ups and downs. It was quite the roller coaster for a few months.
Right. It's a refresh of your immune system. And so there's a lot going on there.
Yeah, it's like my brother and I used to fight a lot when we were kids, and now we were fighting on the cellular level.
That's right.
So,
That's right. So he was a Trojan horse. He went in there
right.
just to fight with you. No,
Yes.
but
Well, which is good. He needed to win. He needed to win this one.
yes. And so after that, well, do you know how long you were at the Hope Lodge? It was a couple more weeks after that just to recover, or?
That I was at the Hope Lodge.
Right.
They told me it was going to be a minimum of 100 days.
Oh,
So
wow.
me being me, I'm thinking I'll be out in 90. Oh, I was so very wrong. I had by the end of February, I was feeling a little better, and into March, and then somewhere in March, I took a real bad turn, and I'm throwing up. I can't keep down water. And my mom said, getting you back to the hospital, which is one of the reasons why it was good to be right there. She called up the nurses. Shari's throwing up, can't keep her meds down. Because I had like, I don't know, it was like 30 medications a day, something like that. I had one of those pill boxes that have 3 things, and then I had an extra one. It was amazing how much pills I was taking. But I couldn't keep anything down. So back into the hospital I went. And that was the time when my mom was there. As I said, for the 24-hour care, my mom would come for 2 weeks, and then my husband would come for a week, and then my sister would come for a week. And now it was my mom's turn again when I had this downturn. Went back in the hospital for 3 days. I don't remember much of anything except laying there saying, if I died, I guess it really wouldn't be that big a deal. Like that.
Wow.
That was the lowest I'd been. And that doesn't last long for me. It's like, okay, that's really, really stupid. I started thinking about all the things that I wanted. I couldn't leave my dogs. We had 4 dogs at home. So I had to get home to them. So anyway, but that was bad. And then by the end of March, I started feeling better. And then into April, I felt really good, good enough to have Jeff, when he was coming that next time, bring our bicycles because I got a ride.
Wow.
And we did a little ride around the University of South Florida, and, which was across the street. And then a couple of days later, he took me to a park. And so that, just being outside and the sunshine and the fresh air just rejuvenated me.
Right.
And then at the beginning of May, things took a really bad turn again.
Up and down.
And the doctor said, your immune system's not flipping. Some of the numbers were not good. They had to do, like I said, on May 5th, 2005, worst birthday ever, had another bone marrow biopsy. And, results really they weren't good. And he said, you might need to have your brother come for, another, transplant. So I let them know that it was a possibility, but Dr. Anicetti was right on top of everything, adjusting medications that I was taking. And over the course of the next, I guess by that time, probably close to a month, all of a sudden he says, well, you ready to go home? Like the day before, I was like ready to call my brother to come in and he says, it just changed. Everything changed. They did a blood test, and all these numbers, I don't know what they didn't do, a DNA test, but whatever the numbers are that they looked at,
Yeah.
showed that it flipped, and now Ricky took over.
Wow. So, thank goodness. That's amazing. By the way, you had written, I know, on your worst birthday ever, it was your 8th bone marrow biopsy. So were they having to do these regular bone marrow biopsies just to check, basically?
Yes.
Right. Okay.
Make sure that it wasn't coming back, and that, everything was still clear. That's what they had to do.
Okay. Last question for this section, and then we're going to move on to our last one, which will be quicker.
Okay.
But the last question is just the follow-up for you in terms of the treatment. I know you told me that it was every 3 months, x-rays, blood tests, then 6 months, then every year. The frequency gets less and less.
Right.
And then you had 2 more PET scans and bone marrow biopsies. But by the time you hit 5 years,
I think I might have had just one PET scan and a MUGA scan, sort of towards the end of my stay there. I don't think that they did any. I'm trying to remember now. I think I might have been mistaken. I don't think we had another. No, I did have one PET scan later. I just don't remember when it is.
That's just a good thing, because it was so long ago. So that's a good sign.
Yeah.
And so you hit the 5 years, and Dr. Anicetti says you were the best result he'd ever seen in a transplant patient to date.
At that time,
how about that?
Wow. That was pretty darn awesome. Because I remember telling him, about what I'd been doing for those, like I said, by the end of that first year, by the end of 2005, I was back riding with my group in my club. I was riding the, 18 to 20 mile an hour rides for 40 miles. And we were doing touring again. It's just, we did bicycle touring, multi-day, 10-day tours, 9-day tours, San Juan Islands. I mean, it was just, I just, really enjoyed, I enjoyed life again, and he could see it.
Yeah, that's what we're going to talk about in this next section too. But that's quite a response to hear from a doctor who's seen so many, countless patients. So happy that treatment ended that way for you, Shari. So we're going to end this portion now. And if you want to hear about Shari's reflections, please just visit the next video.